We started out with the traditional MCG, the book, way back in the day. So I've been using MCG products probably for about 12 years, back when it was Milliman, now MCG. So, and then a little bit ago, probably about a year ago, we went into ICM. And that made it a little bit nicer, got our team, a little more familiar with the criteria. And then just most recently, about 3 months ago, we were able to go live with the IAD, which is fantastic. The decision is that ever since Medicare expanded its observation hours and the need to be, 2 midnights, all of our commercial payers have decided that, well, they want to go 2 and 3 midnights as well to be observation. So tons of denials across the system. And so we were really looking for that partner that would help us guide us and help get our reimbursements. And so that not all patients would be observation and we would get our highest reimbursement for the care that we're delivering. The great thing about IAD is that it's pulling the medical record and the data into our reviews. We still do a very typical review and, why the patient presented, what we're doing for the patient. But it's really great that this tool, the IAD tool, is able to pull the data over to substantiate, that we've said what we said, and it is that, and here's the data to prove it. So yeah, we're really enjoying it, actually. We have, like I said, 5 hospitals. Myself, I have 38 employees. 5 different sites, different diagnoses, different people that come in from different hospitals. And so we're able to use the MCG criteria to substantiate why they came in and why they needed the inpatient admission. So really the biggest denials that we get are for level of care from the observation to the inpatient. And so, and clearly if they're obs, they're obs, but if they're inpatient and we have a payer that's trying to give us an observation reimbursement, we need to be able to have the tools to be able to say, no, the patient is sick and we want to be reimbursed for the care that we're delivering. MCG, the IAD portion, it really guides you so that if you're looking in the wrong area, it'll say, no, maybe not there. You might want to try looking in this area. So it actually gives you the diagnoses and the area to look at. And if you have to deviate from that, or you think you've got a stronger subset that you can use for criteria, then you can go and do that, which is great. So the biggest thing that because we write a lot of appeals for our denials. And so what I love is that I can use this program and I can set the timetable to go back to when the patient was here for a retro. And I can pull all the information out for a retro. So even though we just went live, I want to say 3 months ago, we're writing appeals that we got for stays that were a year ago with the product. So it's super helpful.